Good day, ladies and gentlemen. It is an honor for us today as we present our ethical-moral case study about integrity. Integrity in the ethical case is acting in accordance with an appropriate code of ethics and accepted standards of practice. It is reflected when the nurse provides care based on ethical framework in a profession. For this presentation, we have three presenters. First, yours truly. Second, we have Gario, and then followed by Barrera. First, I will talk about the clinical case. A 47-year-old woman with a history of type 2 diabetes mellitus and hypertension is seen by her physician with a complaint of mid-epigastric pain, especially at night. The pain radiates to the back and is relieved by antacids, but it returns within an hour. The pain is worse when bending forward and better after eating. The physician wants to rule out peptic ulcer disease. A urea breath test and gastroesophageal duodenoscopy are ordered. The patient asks the nurse how breathing into a bag can test for presence of bacteria in the stomach. Now let's have the discussion and solution. First, discuss and describe the procedures indicated for this patient. We have the urea breath test and gastroesophageal duodenoscopy. The urea breath test is a test for diagnosing the presence of a bacterium Helicobacter pylori infection in the stomach. The test is used to demonstrate that H. pylori have been eliminated by treatment with antibiotics. In this case, the test procedure requires patients to swallow a capsule with water. After several minutes, a sample of breath is collected. So when the sample of breath is collected, it is then processed to determine whether you have an active H. pylori infection. To ensure that the urea breath test is able to detect the H. pylori, it is important that, first, the patient has nothing to eat or drink for 4 hours prior to the test. Second, the patient must stop taking all forms of antibiotics for at least 4 weeks prior to the test. Lastly, you will need to cease the proton pump inhibitor at least 1 week prior to the urea breath test. So by the way, the proton pump inhibitor is essential since it blocks and reduces the production and also the secretion of acid in our stomach.
Gastroesophageal duodenoscopy. So, EGD is a test to examine the lining of the esophagus, stomach, and the first part of the small intestine. So, in this case, the procedure uses an endoscope and nurse should perform the following. So, the nurse should check the vital signs of the patient, the wires that are attached to certain areas of the body, and then to the machines that monitor the patient's vital signs. And then, next is to administer a medicine into a vein to help the patient relax, and should remember that the woman should feel no pain and not remember the procedure. And a local anesthetic may be sprayed into the patient's mouth to prevent the patient from coughing or gagging when the scope is inserted. So, where does the scope is inserted? So, the scope is inserted through the patient esophagus, food pipe, to the stomach, and duodenum. And air is put through the scope to make it easier for the doctor to see. So, after the test is finished, if the patient perform properly the gag reflex, so the patient will be able to have food and liquid. Then, the medication is initial therapy that includes cimetidine, IV infusion, or intravenous infusion. Then, the nurse administered an IV bolus with 300 milligrams of cimetidine. So, question: what assessments, actions, and teaching should the nurse perform when administering this medication? So this will be discussed by Ms. Dawn Barrera.
So, these are the assessments. Do history checking in order to know if the patient has an allergy to cimetidine, impaired renal or hepatic function, and lactation. Do physical checking such as skin lesions, orientation, affect pulse, baseline ECG, continuous with IV use, liver evaluation, abdominal examination, normal output, CBC, LFTs, and renal function test. Then, let's move to actions. First, give drug with meals at bedtime, decrease doses in renal and hepatic impairment, administer IM dose, undiluted, deep into large muscle group. Lastly, schedule for regular follow-up checkup including blood tests to evaluate effects. Then, these are the teaching plans. First, educate the patient to take the drug with meals during bedtime to reduce the risk of illness or diseases. Second, the therapy should continue for 4 to 6 weeks or longer and educate the patient to take antacids as prescribed. Third, recommend the patient to have a regular medical follow-up care to evaluate her response to drugs. Lastly, suggest her to seek medical help immediately if she may experience some complications such as sore throat, fever, unusual bruising or bleeding, tarry stools, confusion, hallucinations, and dizziness. Thank you and God bless future nurses.